Working in one of the countries with a leading healthcare system, but doctors in the United States are currently experiencing a severe psychological crisis known as demoralization syndrome. Why and how does it happen? Demoralization syndrome is a condition commonly associated with terminal illness that's characterized by a sense of helplessness and loss of purpose. During patient examinations, doctors frequently encounter such cases. However, perhaps none of them ever thought that one day they themselves would experience such a condition. According to the New York Times, American physicians are now increasingly suffering from a similar condition, except their demoralization is not a reaction to a medical condition, but rather to the diseased systems for which they work. To fully comprehend this issue, we must first acknowledge that the United States is currently the only superpower in the world that does not provide universal healthcare services for its citizens, unlike countries such as France, Germany, and many other European nations. Instead, it maintains a lucrative system of for-profit medicine. According to many experts, this is both a strength and an Achilles heel of the country. For decades, at least tens of thousands of preventable deaths have occurred each year because healthcare here is so expensive. During the COVID-19 pandemic, the consequences of this policy choice have intensified. One study estimates at least 338,000 COVID deaths in the United States would have been prevented by universal healthcare. In the wake of this generational catastrophe, many healthcare workers have been left shaken. A considerable number of them have opted to leave the profession. For me, doctoring in a broken place required a sustaining belief that the place would become less broken as a result of my efforts, wrote Dr. Rachel Bodard about her decision to quit her job at New York City's Rikers Island prison complex during the pandemic. I couldn't sustain that belief any longer. Thousands of U.S. doctors, not just at jails, but also at wealthy hospitals, now appear to feel similarly. One report estimated that in 2021 alone, about 117,000 physicians left the workforce, while fewer than 40,000 joined it. This has worsened a chronic physician shortage, leaving many hospitals and clinics struggling. And the situation is set to get worse. 1 in 5 doctors says he or she plans to leave practice in the coming years. Leaving the profession as a means of escape might indeed be easier than persevering. This is because the marketization of the healthcare sector has profoundly impacted the mindset and caused many doctors to feel disconnected from the field they were trained for. In numerous cases, it can lead to severe psychological consequences for the physician workforce. In July 2018, a psychiatrist named Wendy Dean read an article about a physician who died by suicide. Such deaths were distressingly common, she discovered. The suicide rate among doctors appeared to be even higher than the rate among active military members, those who frequently engage in combat and witness the harsh realities of war. Dean's research findings were subsequently published on STAT, a healthcare news website, and they captured the attention of the medical community. Almost immediately, the National Nurses United, the nurses union in the U.S., took a particular interest in Dean's article and addressed the mental health crisis in pamphlets, bulletin boards, and counseling materials. The New York Times points out that during the COVID-19 pandemic, more than anyone else, doctors were the ones witnessing the dark side of the healthcare system. Many assert that at times, hospitals and healthcare facilities came close to complete collapse due to insufficient public investment and uneven distribution of healthcare infrastructure. Notably, the sudden overload of clinics and hospitals was experienced while they were neither designed nor operated to handle such cases. Additionally, numerous doctors state that the inequality in healthcare standards between the wealthy and the poor is truly catastrophic. This is also one of the primary reasons for the high mortality rates in the country. Furthermore, the New York Times cites several recent investigations and studies that reveal the issue to be much more intricate. Some hospitals and healthcare facilities that receive tax breaks and subsidies for caring for the poor intentionally reduced staff and service quality to accumulate billions of dollars in cash, leaving the underprivileged patients at a disadvantage. For doctors, this is not unfamiliar. However, their professional ethics and morals do not allow them to remain silent and assist in perpetuating this issue. In March 2020, an emergency room doctor named Ming Lin was fired by the leadership of the St. Joseph Medical Center in Bellingham, Whatcom County, Washington, after he voiced his opposition to the hospital's policies and the quality of COVID-19 patient care. In a subsequent interview, Lin stated that he was deeply dissatisfied with the hospital administration's deliberate disregard or downplaying of warnings about the risks of COVID-19 transmission for both patients and doctors. He also mentioned that the hospital intentionally brushed aside many operational and healthcare deficiencies. In 2013, a comprehensive study conducted by Robert McNamara, the head of the emergency department at Temple University in Philadelphia, revealed that 62% of emergency room doctors in the United States were at risk of being fired at any time, without reason or legal procedures, due to their opposition to healthcare quality and unfair patient policies. Furthermore, many doctors were pressured by hospital leadership, mostly owned by private entities, to recommend or even force patients to use expensive healthcare services or procedures instead of utilizing the government's Medicare program. The aim was to maximize profits. The New York Times commented that this contradicted the Hippocratic Oath, as it profited from the most vulnerable and fragile individuals. Since the 1930s, American physicians have repeatedly opposed the socialization of the medical profession, or more specifically, the medical industrial complex, which is based on market principles prioritizing profit. They assert that healthcare services should be based on community principles rather than pursuing revenue, even if it means healthcare facilities and doctors earn less money. However, after nearly a century, the mentioned issue has not seen significant progress. Physicians have shifted their approach to the issue based on community principles, but without undermining the market principles of the healthcare industry. For instance, instead of advising patients to use accompanying services or expensive drugs in order to receive discounts, many doctors have provided guidance on healthcare and risk prevention. For example, doctors often counsel individuals at high risk on COVID-19 infection prevention measures rather than directing them toward costly hospitalization and treatment procedures. The solution to this issue is actually simpler than we might think. They advocate harnessing collective power to influence government actions. Given that the medical profession holds a certain degree of influence and voice in American society, doctors can indeed advocate for reforming healthcare policies, increasing public-private investments in healthcare workforce support programs, and social welfare systems. This is something that the collective of doctors and healthcare staff at Montefiore Healthcare Center in Bronx has done. Another example is from May 2022, when resident doctors at Stanford voted to form a union to protect the rights of both doctors and patients. Since its establishment, the union has organized several strikes to demand improvements in working conditions and social benefits. In December 2021, the American Academy of Emergency Medicine Physician Group, or AAEMPG, an organization representing physicians and medical students, filed a lawsuit against Envision Healthcare, one of the private organizations operating hospitals and healthcare facilities, for violating California state orders by controlling medical services despite patient risks, while Envision Healthcare repeatedly denied the allegations and countersued AAEMPG in May 2022. A judge recommended dismissing Envision Healthcare's lawsuit. This decision was well received by the community. These examples demonstrate that various sectors in the United States are starting to take action to reform the healthcare system. While the outcomes remain uncertain, these efforts are noteworthy and commendable, coming from individuals who have taken the Hippocratic Oath. What are your thoughts on this story? Feel free to leave your comments below. And please stay tuned for the next episode of World Affairs tomorrow.